When most people think about mesothelioma treatment, they picture traditional options, surgery, chemotherapy, maybe radiation therapy. But in the past few years, three treatment approaches have emerged that are changing how we fight this disease, and they might surprise you. We're talking about treatments that harness your own immune system, therapies that literally starve cancer cells, and genetic testing that can predict which treatments will work best for you. Hi, I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade, and today I want to tell you about three treatment options that represent real hope for mesothelioma patients, options that didn't even exist a few years ago. Let's start with the first surprising treatment, dual immunotherapy. Now, you may be thinking immunotherapy has been around for a while now. What makes this approach surprising? Here's what's different. In 2024, the combination of two immunotherapy drugs, ipilimumab and nivolumab, better known as Yervoy and Opdivo, became a standard accepted first-line treatment for pleural mesothelioma. That means it's no longer experimental, it's no longer a last resort. It's one of the primary treatment options that doctors offer right from the start. And here's why that matters. In the Checkmate 743 trial, patients who received dual immunotherapy had a median overall survival of 18.1 months compared to 14.1 months with traditional chemotherapy. That's a significant improvement. But what's even more remarkable is how well it works for patients with the most aggressive forms of the disease that have historically been hardest to treat. So, how does immunotherapy actually work? Think of your immune system as your body's security team. Cancer cells are good at disguising themselves, so your immune system doesn't recognize them as threats. These immunotherapy drugs essentially unmask the cancer cells and activate your immune system to attack them. Instead of the drugs directly killing cancer cells like chemotherapy does, they empower your own body to fight the cancer. Here's what's particularly surprising. For many patients, immunotherapy comes with fewer side effects than traditional chemotherapy. You're not going to lose your hair, you're not dealing with severe nausea, and you're not experiencing the kind of debilitating fatigue that comes with chemotherapy. There are side effects, but they're different. They're related to your immune system being overactivated rather than your healthy cells being damaged. Many patients find these side effects more manageable. The second surprising treatment option is something called ADI-PEG20. It works on a very simple principle, cancer starvation therapy. This treatment is based on a vulnerability that researchers discovered in mesothelioma cells. Here's the science. All cells need amino acids to grow and survive. One of these amino acids is called arginine. Normal, healthy cells manufacture their own arginine using a protein called ASS1. But here's the key. Mesothelioma cells don't have that protein. They can't make their own arginine, so they depend entirely on getting it from the bloodstream. ADI-PEG20 works by depleting arginine from the bloodstream. For normal cells, it's not a problem. They just make their own. But for mesothelioma cells, it's catastrophic. They literally starve to death. It's targeted therapy at its most elegant. The treatment kills cancer cells while leaving healthy cells unharmed. Now, I want to just take a moment here to remind everyone, if you're finding this information helpful, please hit the like and subscribe buttons. It really helps us get our videos seen by as many people as possible. And if there's a topic you'd like to see covered or a question you'd like answered in a future video, let me know in the comments section below. Also, make sure to watch until the end of this video, where I'll tell you exactly how to access help and resources if you or someone you love has been diagnosed with mesothelioma. Now, getting back to ADI-PEG20, the Atomic Meso trial tested ADI-PEG20 combined with traditional chemotherapy, and the results were remarkable. Patients who received this combination lived 4 times longer at the 3-year mark compared to patients who received chemotherapy alone. Let me say that again, 4 times longer. This trial is the result of 20 years of research that started with a basic discovery about how mesothelioma cells work, and it's now changing patient outcomes in a measurable, dramatic way. Now, I need to be clear about something really important. The FDA has not fully approved ADI-PEG20's use in mesothelioma yet. However, patients may still be able to access it depending on trial enrollment status and FDA guidance. If you're interested in this treatment, talk to your doctor about whether you might be eligible for a clinical trial or compassionate use access. This is exactly the kind of question that a specialized mesothelioma treatment center can help you answer. Now, this brings us to our third surprising treatment option, which isn't actually a treatment at all. Rather, it's a way of personalizing treatment to each individual patient. The third option is germline genetic testing. I know that sounds technical, but stay with me because this could be one of the most important steps a mesothelioma patient takes. Recent research has shown that between 5 and 14% of people diagnosed with mesothelioma carry an inherited genetic mutation. Most commonly, it's something called a BAP1 mutation. And here's why this matters. Patients with BAP1 mutations survive significantly longer than patients without them. We're talking about a median survival of 5 years compared to less than 1 year. But it's not just about prognosis. Knowing whether you have a BAP1 mutation or other genetic alterations completely changes your treatment strategy. Patients with germline BAP1 mutations respond particularly well to platinum-based chemotherapy regimens. This means that genetic testing can help your doctor choose the treatment that's most likely to work for you right from the start. It takes the guesswork out of treatment selection. The 2024 ASCO guidelines now recommend that all patients diagnosed with mesothelioma be offered germline genetic testing. This is a major shift from just a few years ago. And there are additional benefits beyond your own treatment. If you test positive for a BAP1 mutation, your family members can be tested too. They can enter personalized cancer screening programs. And for certain BAP1-related cancers like uveal melanoma, screening can begin as early as age 16. Early detection saves lives, and this information could protect your children, your siblings, and future generations of your family. Now, something important about these 3 treatment options. While I've called them surprising, what's really surprising is how quickly the standard of care for mesothelioma has evolved. 5 years ago, patients had just one option, platinum and pemetrexed therapy, chemotherapy. Today, patients can choose between that traditional chemotherapy, dual immunotherapy, or a combination approach with pembrolizumab plus chemotherapy, which, by the way, was FDA approved in September 2024 and shows a 62% response rate. The availability of multiple effective treatments means that doctors can now tailor therapy to each patient's specific situation. If you have symptomatic disease with a high tumor burden, the pembrolizumab combination might be best because of that high response rate. If you have kidney disease or other conditions that make chemotherapy risky, dual immunotherapy might be your better option. If you have a BAP1 mutation, platinum-based chemotherapy might give you the best outcome. Treatment is becoming personalized in ways that were impossible just a few years ago. So, those are the 3 surprising treatment options for mesothelioma. dual immunotherapy that harnesses your immune system and is now a standard first-line treatment, arginine depletion therapy that starves cancer cells while sparing healthy ones and has quadrupled long-time survival in trials, and germline genetic testing that helps predict which treatments will work best for you and can protect your family members through early screening. The landscape of mesothelioma treatment is changing rapidly. These options represent real hope, real progress, and real improvements in survival and quality of life. If you or someone you love has been diagnosed with mesothelioma, make sure you're being treated at a specialized cancer center where doctors have extensive experience with these newer treatment approaches. Finally, I want you to visit mesothelioma.net. Fill out our form for a free information packet with comprehensive medical and legal information. You can also call us at 1-800-692-8608 or use the live chat feature on the website to speak directly to one of our patient advocates. As for me, remember to post any questions you have below. I'll see you next time.